As coronavirus COVID-19 continues to wreak havoc globally, the rate of infections in the country is also increasing. As of Friday, the infection rate hit 122 people. Confirming the numbers, Health Chief Administrative Secretary Dr. Mercy Mwangangi said the new cases were part of the 362 samples that were tested in the last 24 hours.
12 people have tested positive for coronavirus disease. Out of this number, 11 are Kenyans and 1 Somali national. This now brings the total number of those who have tested positive for the disease in the country to 122. To date, we have managed to test 1,433 samples from individuals currently in quarantine facilities. We are now remaining with 617 individuals to be tested.
The government says the country's death toll has also risen to 4 after a 6-year-old boy who was undergoing treatment at the Kenyatta National Hospital died.
Regarding the 6-year-old who died in Kenyatta National Hospital, of course, the necessary infection prevention control measures have been put in place, including quarantining of the staff that handled this particular deceased child. We have also been in contact with Kenyatta to ensure that that particular place has been disinfected and all those patients moved elsewhere. We are in the process, of course, of testing them because, you know, people who are in ICU, in terms of risk profile, they are at a very high risk of contracting COVID.
It further adds the new cases are from the following counties:
Kiambu, 1. Laikipia, 1. Mombasa, 2. Nairobi, 7. Nyeri, 1.
Percentage of men affected by the virus is higher than that of women. 8 men and 4 women are the latest statistics.
9 of the confirmed cases were detected in the designated quarantine facilities, while 3 are from suspected cases admitted in isolation units in various health facilities. The ages of the confirmed cases range between 28 to 68 years. We have so far monitored 1,721 contacts, and out of this number, 1,073 have been discharged. Currently, there are 648 contacts that we are actively tracing.
Based on our calculations, that is about 25 to 30% of the cases that we have so far are local transmission. Local transmission occurs in forms of clusters, and these clusters, if they are not controlled, then they merge into bigger clusters, the so-called snowballing effect. And that is why we are really very, very firm on contact tracing, to be able to ensure that if you have any evidence of local transmission, then we go down to the area where this has been reported, make an appropriate contact tracing process to be able to ensure that everybody is brought on board.
Gloria Milimu, K24 TV.